This video contains 10 little-known facts in the C-section versus vaginal birth debate. Number 1. The greatest risk factor for pelvic organ prolapse at any age is vaginal delivery, and yet it's been reported that only 1 in 5 women are even aware of its existence. 68% of women were not aware of it before experiencing symptoms, and 81% of mothers report that they did not receive antenatal education about it at all. Number 2. It is estimated that 7 women would have to have caesarean births only in order to prevent 1 woman from having a pelvic floor disorder. But this creates a dilemma. On this specific measure alone, some might claim that 6 of the 7 caesareans would be unnecessary, and yet no one can identify the 1 in 7 woman who is at risk of damage. This is where choice comes in. You might focus on the protective effect of a planned caesarean, similar to having no children at all, but equally you might feel confident that you'll be one of the lucky ones. Number 3. A 2003 US study found that there were significantly higher than expected vaginal complication rates in hospitals with lower than expected caesarean rates, and lower than expected vaginal complication rates in hospitals with higher than expected caesarean rates. This, it said, was suggestive of, but not definitive of, inappropriate underutilisation of pre-planned first-time caesarean deliveries. Number 4. The risks associated with a planned caesarean are significantly less than those associated with emergency surgery. Always bear this in mind when reading research, medical studies, media reports or any other source. Ask yourself, is the information relevant? Number 5. Back in 1985, the World Health Organization recommended a 15% caesarean rate threshold for all countries. As of 2009, this is no longer the case. Why? Because after nearly a quarter of a century of criticism, the World Health Organization had to admit that there is no empirical evidence for an optimum percentage or range of percentages. It said, pending further research, users of this handbook might want to continue to use a range of 5 to 15% or set their own standards. And the latter is what's been happening in many countries, with rates in excess of 25% becoming the norm. Number 6. One of the United Nations Millennium Development Goals is a 75% reduction in the deaths of mothers by 2015. In an interim progress report last year, 4 countries were highlighted for achieving accelerated progress in reducing mortality. They were Egypt, China, Ecuador and Bolivia. But what do these countries have in common? Rapidly increasing caesarean rates, which is why they are more often criticised for their caesareans than they are celebrated for their saving of lives. Number 7. When the outcomes of different birth plans are compared, and when care costs beyond the immediate birth period are taken into account, for example treating babies' injuries, damaged pelvic floors, psychological counselling, then a last resort policy for caesareans can prove a false economy. The cost of litigation is an inescapable reality in obstetric care too, with the largest payouts being predominantly associated with planned vaginal births. Number 8. We all know that hindsight is the perfect science, but what many women don't know until it's too late is that with the benefit of hindsight, vast numbers of infant deaths and injuries, including stillbirths at term, might have been prevented by planning a caesarean birth at 39 plus weeks gestation. Number 9. Convenience is one of the least frequently cited reasons by women and doctors when deciding to choose a caesarean birth, and yet it is one of the most frequently cited reasons by critics of maternal request caesarean. In fact, a caesarean's prophylactic benefits, not convenience, are mentioned most by women who say that their main priority is to prevent the possible and probable risks associated with labour. Finally, number 10. Like beauty, birth risk is largely in the eye of the beholder. Some perceive birth as inherently risky, others perceive birth as inherently safe, and this affects an individual's risk-benefit analysis. They weigh up clinical evidence and likelihood of risks alongside their own personal perception and tolerance of different risks. And in the end, when planning the birth of your child, I believe that it's your baby, your body, your choice. You should make it an informed one. Thank you for watching, and please visit one of these websites for further information and more facts like these.